are thousands of different contributing factors that lead to criminal behaviour. One of the most commonly talked about factors is substance abuse, and in particular, drug abuse. Drug abuse is defined as the habitual use of drugs not needed for therapeutic purposes, used solely to alter one's mood or state of consciousness, or to affect a body function unnecessarily. There are many examples of substance abuse. However, the focus for this presentation will be two specific sections of drug abuse: how significant heroin is when dealing with criminology, and how alcohol plays a role in the recidivism of criminals. Heroin is a drug used to simulate extreme pleasure for a short period of time, followed by a longer period of time where the user experiences lethargic feelings. This drug has an extremely high addiction rate. In 2004, 384,800 people aged 14 years and over reported having used heroin, methadone, or other opioids in their lifetime, with 56,300 of these people using them in the previous 12 months. This data shows that the addiction rate of this substance is concerning when we look at the correlation between this drug and criminal behaviour. There are many links between criminal behaviour and drug abuse. Criminals commit crimes to pay for drugs, as well as committing crimes because they are under the influence of these illicit substances. As seen in data collected from 2010 research conducted in the United States, 70% of all male inmates were drug abusers. Another alarming factor of heroin is when you look at tolerance. Regular users of the drug can develop a tolerance. This means users are taking higher, more lethal doses, which is what the high rates of heroin overdoses can be attributed to. 20% of all drug-induced deaths in 2016 were a direct result of heroin. Alcohol is a major issue in Australia. This directly correlates with our nation's drinking culture. Due to the easy accessibility of this drug, it is Australia's most commonly used drug and is also assumed to hold responsibility for 1/3 of Australia's car accidents, as well as being a present factor in 3/4 of Australia's assaults. Alcohol is responsible for 12.3% of all drug-induced deaths in 2016, according to data presented by the Australian Bureau of Statistics. This shows that a drug that is present in our everyday life was also the 7th most widely spread lethal drug in the country last year. There is a two-way connection between alcohol and aggression. Not only does excessive alcohol consumption often lead to aggressive behaviour, but victimization is a reason for excessive alcohol consumption, creating a never-ending cycle. Alcohol plays a major part in the criminal justice system. This drug is often a major contributing factor for why offenders are in the system, as well as ensuring that the recidivism rates of these individuals remains high. There are institutions in place to preempt these offenders from offending in the first place. However, there are so many of these institutions that are functioning the exact same way, and it is obviously not working. The research presented in this video is only a small portion of what has been conducted over the years. This is especially evident when you look at the copious amounts of research behind alcohol in regards to criminology. This area is so advanced that there are already many programs in place to reduce the statistics regarding alcohol in the criminal system. However, some of these techniques and programs aren't working effectively, or they only work for specific targeted groups. Using the research collected and presented in this presentation, some ways that alcohol's role in the criminal justice system can be reduced are rehabilitation institutions that work with the patients and a team around them. This team would include psychologists, family members, doctors, and the patients to ensure that the patient is getting a targeted rehabilitation plan rather than a general one which doesn't include their individual needs. Ethical concerns associated with substance abuse involves topics such as the difference between private and public concerns, and what happens when the two of these are a concern for the same issue. Another ethical concern is the dilemma of personal judgment, values, and beliefs. The difference between public and private concerns becomes extremely prevalent because substance abuse affects the public through taxes and disruption of community, and it is a private concern because it is an individual's life and the choices they make or that are made on their behalf affect their well-being and future. Dilemmas of personal judgment, values, and beliefs become an issue when there are a group of people involved in the care plan provided for an individual. For example, the program suggested earlier in this presentation. There are a large group of different people involved in sorting out a program for an individual. This arises the question that the group might have different views, and how do we face those issues? In summary, there is a significant link between substance abuse and criminology. This is present through the number of detainees and past detainees who are regular drug users, as well as the data collected regarding the number of drug-induced deaths. Without programs such as the one presented, one that is targeted to individual substance abusers, these rates are not going to decrease.